Several countries in Africa are dealing with growing outbreaks of Mpox, with Ethiopia among the latest to confirm its first cases of the disease. Mpox is caused by a virus and spread by close contact, causing flu-like symptoms and skin sores. It's usually mild but can be deadly. The World Health Organization says 720,000 doses of a vaccine have been administered across 7 African countries. Well, that's well below the target of 6.4 million. Since the start of 2024, more than 37,000 Mpox cases have been reported to the WHO from 25 countries, including 125 deaths globally. The Democratic Republic of Congo accounts for 60% of confirmed cases and 40% of deaths. Other affected countries include Uganda and Burundi, as well as Sierra Leone, which recently called for international help to combat a growing outbreak. Well, Dr. Jean Kaseya is Director General of the Africa Centres for Disease Control and joins us from the Ethiopian capital, Addis Ababa. Welcome to DW, Doctor. What's driving this increase in cases?
Yes, thank you, Phil, for having me. Currently, we are saying that Mpox is in 20 countries in Africa, but mostly active in 15 countries, including, as you are saying, DRC, Sierra Leone, Uganda. And these countries are now mostly where we have more than 85% of cases. But last 2 weeks, what we saw, Sierra Leone is giving us more than 50% of cases notified. Factors can be quickly discussed, like for the case of Sierra Leone, you know what we call the urban spread in a densely populated area, Freetown. This is the capital for Sierra Leone. We have also the clade, like in Sierra Leone, the clade 2B, that is highly transmissible strain, is leading this transmission. We are also talking about the health system that is under stress. And we are also having the limited supply, vaccine supply in a number of countries. This is why we are pushing for this agenda of local manufacture for vaccine.
OK, so urban spread, a highly transmissible strain of this disease and stress the health system all contributing. So what could bring it under control?
What can bring that under control is first to vaccinate more people. We see in some countries like Burundi, when we started to vaccinate, we saw the trend of this outbreak going down. The second one is to continue to reinforce what we call the contact tracing. It means to reinforce the surveillance and to trace every contact, people who are in contact with those who are sick. We are also working to strengthen the cross-border surveillance because we don't want to see countries affected to infect other countries or vice versa. And we are working to facilitate also what we call the strong community involvement through community health workers to provide information, because in some countries, and this is the case in Sierra Leone, we saw the sexual transmission is still high. Then having people, communities involved can help us to contain this outbreak.
Let's talk about the vaccination program. How is that going? Do you have enough vaccines? Are people getting vaccinated?
Yes, we got some vaccines, from Bavaria Nordic through our collaboration with European Union. We got vaccines from Japan. We got vaccines from a number of countries like the US, but we still lack what we need to stop this outbreak. And you will see in a number of countries, in DRC, in Sierra Leone, we are clear and we are saying it. People, they accept vaccine. What we lack today is availability of this vaccine.
Right. So what's the problem here? Because you just listed a number of countries who are providing you with it, and now you're saying you don't have the vaccine. So are you not getting sufficient?
We are not getting sufficient vaccines. Our plan was clear. We wanted, there are countries, they committed to give us 1 million doses, but we didn't get this 1 million doses. We also have countries committing to support the transfer of technology, we call it tech transfer, to Africa to manufacture vaccine. Currently, we are missing around 50 to 55% of the vaccine we need to vaccinate everyone in need.
Ethiopia recently reported its first Mpox cases and the first death from the virus. What's the situation in Ethiopia now?
I have to congratulate Ethiopian leaders because first, they were so transparent by reporting this first case. And this is a case of importation. Unfortunately, this is a child, a 20-month-old child who passed on because he was infected by his father, who is a driver of a truck coming from another country. But currently, we have 6 confirmed cases. All of them are in isolation centers, and the government of Ethiopia is providing sufficient support to make sure that we don't have additional cases. Yes, we have 26 suspected cases that we are doing what we call the contact tracing, but currently I can say the situation is under control in Ethiopia.
OK, thank you so much for talking us through that. Dr. Jean Kaseya, Director General of the Africa Centers for Disease Control and Prevention. Thank you so much.
Thank you.